This is The View from Where We Live. The View from Where We Live, where we'll take a look at the stories of our time.
Welcome to The View from Where We Live. I'm your host, Mary Eckert, and today we're looking at some new money coming in to the Lakeshore Community Health Center, a new facility in Sheboygan for the underserved. And our guests today are, one is from Kenosha, Jack Waters. He is executive director of the facility in Sheboygan. And Ann Wondergem, welcome. She is from United Way, and she's responsible for the health center as a project of United Way. Before we talk about the money, which is the reason we're here, can we talk about the need, which is so startling? I just heard about this last week, that the percentages of underserved in Sheboygan, the unemployed, is so high, above average. Could you go into that, Jack?
Sure. The community of underserved people we define as people that are either uninsured or covered by Medicaid. And the number of people covered by Medicaid is 18,700 individuals right now in Sheboygan County. And it is estimated that another 11% of the Sheboygan County population is uninsured. It's another approximately 12,000 people. So you're talking about approximately 30,000 individuals within Sheboygan County that currently are either uninsured or covered by Medicaid.
That's like a third of the county. Does this just serve Sheboygan, or does it serve the county?
It serves Sheboygan County, so it's all county residents. And it's about 115,000 Sheboygan County residents. Yeah. I think the other interesting part is about 7,000 to 9,000 at any point in time of those 18,000 Medicaid or Badger Care recipients are children. And especially when we talk a little bit about some of the services, how important those services are to the children of our communities within Sheboygan County. Even
the healthcare center itself is very new. You've been in operation since October. I wasn't aware of it until last week. Why is it unknown? Why is it quiet?
I think one of the things is we started out in January, and we provided dental services at that point in time. And I should tell you just a little history to kind of fill you in. Probably about 6 years ago, United Way worked with Healthy Sheboygan County 2010, which is now Healthy Sheboygan County 2020, and really began to talk about gaps in services within the county to meet the needs of the uninsured and underinsured. Those that really need those services. Looking at primary health care, looking at dental care, and then also looking at mental health or behavioral health services. We knew the need was there. 6 years of planning led to applying for a federal grant, and we didn't receive it. In the meantime, we worked with our partners in Manitowoc County through their Healthy 2020 project and applied for a dental grant and received that dental grant. So in January of this year, we began operating dental services through Healthy Communities, Healthy Teeth of Manitowoc County.
Because Sheboygan people went to Manitowoc?
We had a place in Sheboygan, exactly where the clinic is located now, that they could receive services, and we operated 1 day a week through June. So imagine 30,000 people who could benefit from dental services showing up at your doorstep. It was just not feasible. So when you talk about people not hearing about us, we went to key places to tell people about our services, our emergency departments where people are presenting with health issues that don't have insurance, our medical providers, some of our partner agencies, Bridgeway, which serves women in transition with their children, Head Start programs, so that we were really targeting what we were looking at doing to the population that could benefit from our services. Then in October was when we added the primary health care component. So we've been around a while. Just as an example, Mary, Nancy Jeske from United Way did a brief little statement in February about the dental program. They couldn't keep up with the phone calls. So we're hoping your program doesn't generate that type of phone call process also.
Okay. The need is so great. What are some of the responses you're getting when people call? Can you give any little story, any little scenario of the kind of response you get when they hear about this being available?
Well, I think that the response that you get is what's sort of not seen is that people that are covered by Medicaid or uninsured, they struggle with access to care. And so when it becomes available to them, they're more than grateful. But they all have stories in regard, many of them in regard to how maybe at one time they had insurance, how maybe they lost insurance, how maybe they have a family member that's on different medications, or they have a family member that's a diabetic that hasn't been able to get to a doctor. And so what they talk to you about is about the struggles that they have in actually accessing primary care.
Do you think they feel unentitled to health care and stay away from even seeking it?
I would say it's the cost. Just as an example, I had a mother call me up before we had the dental clinic available saying her son had a toothache. She was able to get some medication for him, but she was not able to access dental care because she didn't have $100 to actually make that first appointment. I was able to give her information at that time on a program in Milwaukee, and her response to me was, I take the city bus to get wherever I go to, so I don't have transportation. So part of it is they just don't have the resources. Part of it is they've kind of been down that road before. And they look at the bills and they just can't afford to pay it. And they sometimes don't understand how to talk to people about what kind of payment system, where at the clinic we'll talk with them up front in terms of what they need to do.
Well, there is some money coming, and some money has already come that allowed you to establish this in the first place. But let's talk about that money now, where it's coming from. Where exactly is this new funding coming from?
Why don't you let Jack and I kind of tag team that?
Yeah.
Back when we first started, United Way put up $20,000 for the initial planning phase. As we move forward, we put up, in terms of United Way, another $20,000, and Aurora Health Services and St. Nicholas Hospital put in $20,000, which allowed us to complete that planning process and have some seed money. And then last December, we were very, very fortunate in the Acuity Charitable Foundation giving us $100,000 to really get things rolling along with the small dental grant that became available.
Can you say specifically what that $100,000 went to? I mean, what access did it provide for people actually being able to come in and?
Well, it's helped, for example, as soon as you start providing dental care, we provide primary dental care, and so somebody will walk in that will require an oral surgeon. So some of that money has gone to help to access, work in partnership in the community to provide oral surgery access or pediatric access for children that need additional care beyond what we're able to provide. It's helped us to put a nurse practitioner in place, and it's helped us to provide care for people that when you talk about the federally qualified health center piece and the grant, we provide discounts to people that are under 200% of the federal poverty rate. Well, there's a group of people that are beyond 200% that can't afford insurance, and so it also goes to helping to provide discounts for those people to be able to provide access to care.
And I think the real key is this is not a free clinic. People do contribute towards the cost of their care, and I think what I've seen is they appreciate it. You asked about a story. There was a gentleman there one morning when I was there, and he was pulling out his $3 out of his wallet and saying to the receptionist, "This is my final payment on my copay because my wife had some serious dental issues and was in pain." And he said, "Now that I paid this, I feel comfortable making an appointment for my 3 children who haven't seen a dentist in 6 years." So you also see that people do want to pay. They don't feel it's an entitlement. They feel it's a privilege to be able to get services.
That's why I would think they might be staying away, is because
It's like Van said, it's sometimes cost prohibitive, there's barriers, but when you make it affordable, that what you find is people are willing to pay. They're just looking for a place where they can pay and it can be affordable to them and they can gain access.
now we talked about the new funding, but is there a community aspect to this?
Absolutely, and I think, you know, through United Way, we've seen people donate, but I want to just talk about a new thing that just came about. Acuity has been very generous, and this year the Acuity Foundation presented us with a challenge, both Lakeshore Community Health Center and United Way, and we have until February 28th. And should we have enough donations, we will be matched up to $100,000. So this is how I look at it. If we have 1,000 donors, whether they be individuals, whether they be corporations, businesses, foundations, if 1,000 donors would each give us $100, we'd have $100,000, no problem. Now, if 100 people want to give us $1,000, that's great. And if somebody has just $1, if one of the patients coming into the center gives us $1, it gives us another $1. So we have until February 28th. I'm optimistic, once I put it in that perspective, that we can manage this, that we'll see that. And what I have found is that the community does understand the need when we go out and talk with them.
How's this going to happen? Is there a campaign? Is there a pledge form? Can you pledge? Do you just donate?
We have some pledge forms if people are interested. For people that would like to contribute through payroll deduction, because United Way offers that, they can do it through payroll deduction. They can stop by and drop a check off at Lakeshore Community Health Center and get a receipt. They can drop it off at United Way. We have processes in place to track this, so we know how much is coming in terms of new revenue to meet the requirements of the Acuity Challenge. But what a fantastic opportunity Acuity Foundation has given us as a challenge, and the community as a challenge, to help everyone meet these needs. And when you look at a young child coming in with a toothache, or the 60-year-old woman who has some serious dental issues and then finds out she's over 200% of poverty and goes away in pain, and we can follow up and say, but we can work with you and find ways to make this manageable for you. That's what we're really here to do. And Jack, we haven't talked at all about services, Mary, so maybe we should let Jack do that.
I want to wait.
Okay.
I have one more question. You said they can drop a check off or whatever. I think we should make very clear where the clinic is located.
Oh, absolutely.
On North 8th Street near Bluff Avenue. And if you want to give the specific address.
Sure, it's 1931 North 8th Street.
Okay,
is where
it's on the east side of the street.
Yes, it is.
Red brick building.
It's well, it has some red brick and white.
Yeah, okay. We just want to give people a
And if
mental
they,
location.
for some reason, they couldn't get to the clinic, they can gladly stop in at United Way, and we'll make sure the donation gets to Lakeshore Community Health Center.
Before we get to the specific services, though, there are a number of people who took responsibility for providing this in our community. I want their names.
The Lakeshore Community Health Center has a board of directors, and the president of that has been Dale Hippensteel. So he's worked very closely on this project, and he currently works for Sheboygan County as their manager of public health services. Kristen Blanchard, who probably many people know, was very instrumental, and she's vice president and worked very actively on the grant. We had staff from St. Nicholas and Aurora Hospital involved in this throughout the course of the project. United Way, of course, through Joanne Van Horn Wayland, and then myself later on, were very involved. Bev Randall, who retired from Mental Health America, was instrumental in helping write the grant. And then we can't forget, besides Acuity and Aurora and St. Nick's, Dr. Kurt and Ruby Kellner, in terms of their former dental practice, and the building that we're operating out of has just been a tremendous resource.
Okay. Let's go into services now and tell specifically what you can provide for people.
Well, we provide primary medical, primary dental, and primary behavioral health services. So those things that you would expect if you went to your doctor's office, cough, colds, flus, preventive exams, laboratory services, referrals to specialists, ultimately inpatient services as well. In dental, again, it's what you expect to go to your dentist for exams, for minor restorative care, for cleanings.
Care.
We'll provide emergency care as well.
Keep people out of the hospital emergency rooms?
Well, the intent of our services, and when you do primary care, is that you're there to provide preventative care. The challenge that we have with an underserved population is moving that population from emergent to preventative. So if you can't access care, then normally when you show up in the emergency room, usually in a crisis situation, because that's what drives you to get there. Our job is to create access. One of the things that we talk about a lot is that, especially in the Medicaid program, one of the things that we did in our Medicaid program in the state for the last number of years is we created eligibility. We made sure that all children were covered. We made sure that all pregnant women were covered. We were working towards making sure that childless adults were covered. Well, we created eligibility. Ann was talking about when they started this project, there were 11,000 Medicaid covered individuals in Sheboygan County in 2006. Today I said there was almost 19,000. Some of that is economic. Much of that is on purpose because we created eligibility. And if all you do is create eligibility and no access, you get entry into the emergency room. So our job is to provide primary care. Those of us that have insurance, we don't go to the emergency room. We go to our primary care doctor. We go to our primary care dentist. We go to seek outpatient clinical behavioral health services. That's how those of us that have access care. So our job is to provide for an underserved group of people access to primary care medicine, whether it's medical, dental, or behavioral health.
And you term that providing eligibility?
Providing access. Eligibility is...
They become eligible for access.
That is correct.
Yeah.
Yeah.
So they're interested in becoming eligible.
Right, and we've defined, I mean, when we talk about underserved, we're defining sort of the eligibility.
Right.
Okay, we're not here to serve the commercial population that has insurance and accesses care. We're here because one of the challenges we face in our community is there's a group of people that struggle with gaining access to care. And that's really our job, is to create access. When Ann talked about starting in January, there weren't dental services that were available in this community for this population of people. And that was an access issue. And when we started doing medical services in October, that creates additional medical access, and shortly we'll add some behavioral health services to that equation. But it's all about creating access to care for individuals.
Who are the doctors that work at the clinic?
We employ
Specific doctors, or are they coming from other places?
No, we employ. We employ and we work in contract in conjunction. We employ currently a dentist, our full-time dentist. We have a couple of hygienists that we employ. We just recently hired a nurse practitioner. We will continue to employ because, again, much like your primary care doctor, that's an established physician. We're a mid-level provider in a practice that's there all the time. And you go back to that person. And so it's exactly the same. This is a great model of care to provide. That, you know, Ann talked about the people, and you've heard me speak about it. The people that worked on this grant, they should really build statues to these individuals, because this is a grant. It's one of the only grants that I'm aware of that once you receive it, as long as you do the job, you receive it every year for the rest of your life and beyond.
And that figure is?
Well, our federal grant is $650,000 a year. And, you know, so you hear a lot of conversations today in regard to the fiscal cliff, and they talk about 10 years. That's $6.5 million into Sheboygan County that wouldn't have been here over the next 10 years.
And that $650,000 is going to provide, continue to provide how much? What? How many appointments?
What you do is there are three pieces that come with this grant. One is the federal grant. The other piece that comes is cost-based reimbursement. And so we get reimbursed for seeing a Medicaid patient at cost. One of the reasons the traditional system, medical and dental, doesn't see or manages access for Medicaid patients is because of what they get paid. And it's legitimate in regard to the difficulty in the traditional system to provide care given the reimbursement rates for Medicaid. And therefore, because we get paid cost, we're able to provide care to a Medicaid population. The federal grant allows us to provide care to the underinsured or an uninsured. The issue, what you get to see is For example, I also manage a health center in Kenosha. So we received the same $650,000 grant. In 2008, when I took over the health center, we served 6,000 people. This year we'll serve 20,000 people. The same $650,000 grant. The opportunity is to create an infrastructure of staff to support providing access to care. Those of us that have insurance, we access care at a rate of about 60 to 65% a year. So the number one health disparity, which is aside from serving underserved people, we're here to reduce health disparities. And the number one health disparity is access to primary care. And therefore, when we're serving 60% of that 30,000 people, we'll have closed that health disparity that says, here's a group of people that struggle with gaining access, but if we're serving 18,000 people, we'll have closed that health disparity.
Mm-hmm. Now, it's not free. There are fees determined by house, like the number in the household and their income?
Correct.
Do you want to just leave it at that? Or?
Sure. What we do is every patient that comes in, we ask them to sit down and work with us to determine a household income. And the purpose of that household income for those individuals that are uninsured and maybe individuals that have insurance but it doesn't cover a certain service, that we're able to provide a discount. And that discount is provided to anybody that is under 200% of the federal poverty rate. Now,
By that you mean their income is lower
it's
than
200% or below
rate.
poverty. So the poverty rate is approximately $11,000. And so if you are a single individual, it's $22,000. So if you're at or below 200% of the federal poverty rate, we provide a discount. So for people under 100% of the federal poverty rate, we charge a nominal fee. That's $25.
Okay.
And
your income would have to be what figure?
$11,000 is the 100% of the federal poverty rate.
Okay.
And so if you're under that, or you're at or below that, your cost is $25.
Okay.
And then it grades up to, at 200%, it's $70 for your service. And so that's a way that we can have our patients participate in their care financially. They make contributions, and then we use a portion of the federal grant, depending on the services they provide or receive, to cover the remaining costs for doing that. So that's how we have our patients participate in the care.
With your experience with these centers around the state, what's the economic impact going to be on Sheboygan?
Well, the economic impact, as I said before, one is a federal grant.
Yeah.
Two is an additional reimbursement rate for Medicaid patients. So Medicaid patients currently get seen in this community, and the reimbursement rate is at 27 cents. The third thing, and the main thing that's going to come about in economic impact, is jobs. And so we will employ people, and we will employ doctors, and we will employ dentists, and we will employ medical assistants and nurse practitioners, some well-paying jobs with benefits. The health center that I run in Kenosha, when we got there, we employed 30 people. Today we employ 150. I can tell you there's not a lot of employers in Kenosha County that added 120 jobs between 2008 and 2012. And so the economic benefit here is that people will get jobs, they get good paying jobs, they have benefits, and then on top of it, it provided access to care to people that struggle gaining access to care.
It eliminates a crisis.
And the people that work for us I spent 15 years in the traditional healthcare system. They come out of the same programs, they come out of the same residency programs, they came out of the same dental schools. They are as well trained and as qualified professionally as any people that are out there. And there's normally this stigma that comes across in healthcare, in community health centers, that if you take care of poor people, you provide poor care. The people that we have are as well trained. The equipment that we have is as good as anybody else's equipment, and we will be measured based on quality indicators, just like everybody else is in healthcare, in regard to how are you managing your diabetics, how are you managing your patients that have high blood pressure, how are you doing with immunizing your children? All of those same indicators that everybody else in healthcare gets measured on.
And it's the same standards, the same
Professional.
accreditation.
Same.
Absolutely.
Yeah.
Yep, everything.
Yeah.
Everything that we do. We had our personnel committee this morning. One of the things that we're required to do is we're required to credential all of the providers that are on our staff. Now, they get credentialed with insurance companies, but much like hospital systems, we're required to go through a credentialing process to make sure that all of our providers meet certain standards, and then the board will vote them on to be part of our healthcare staff. And so there's not a lot different in what we do than what people are normally used to seeing in a primary medical or dental or behavioral health clinic.
I think there's another economic impact that we can't quantify a lot of times, but if I have some health conditions that are preventing me from being employed, and it's difficult for me to maintain employment, and now my health conditions are addressed, I can
You're
go out
positive on the community rather than a
Right.
draw
Keeping-
child
on
who-
the economy.
a child who, you know, is really struggling with tooth pain isn't going to pay attention in classroom, isn't going to be able to eat. Once we can take care of that dental issue, what a positive difference. So there are other hidden things that are there that really create just a economic impact, but also a personal impact.
Yep.
It's so good to see a really positive influence on the economy as well as for the people in the
Absolutely.
community. It's, yeah, awesome. Any final thoughts, either of you?
Well, we appreciate the opportunity to be able to be with you and to share this. As Ann said, we're here to get the word out, to let people know that there is this opportunity, being able to have here and share what it is that we're doing. And you know, we believe strongly that the community, as we talked about before, has been tremendously supportive, getting us to this point and continues to be. And
I want to ask before we close, which is in a few seconds, please give like 30 seconds how to donate. We're trying to match a $100,000 grant from Acuity. How do they get the money to you?
The best thing to do is to write out a check to either United Way or through your payroll deduction, or write out a check to Lakeshore Community Health Center. They can drop it off at United Way, 2020 Erie Avenue, Lakeshore Community Health Center, 1931 North A Street. The other thing is we want to encourage people that are struggling to have their dental and medical needs met. Please call to make an appointment to find out more. And because I don't know the phone number off the top of my head, Mary can read it right from the sheet in front of her.
920-783-6633.
Yep.
And with that, I want to extend my thanks to you, my guest, Jack Waters. He is Executive Director of the Lakeshore Community Health Center here in Sheboygan and also in Kenosha, and Ann Wondergem, who is Project Manager for United Way of Sheboygan. I'm your host, Mary Eckert, and I hope we've enhanced the view from where you live.